Today's topic, tools to help protect against COVID-19. There are 7 tools that I want to discuss with you. You know, we've been living with COVID-19 for almost 2.5 years now, which began back in March of 2020. It is now May of 2022. And the CDC has been sending out public information in reference to social media, flyers, discussing, matters about advising, reminders, and so forth. And the CDC just sent a new one, which is recently this flyer here that I would like to share with you. It's very interesting. So what I want to do is I wanted to create a vlog to share with you in the community. Now, the CDC wants you to remember these 7 tools. These 7 tools are broken down into 3 categories. The first category is prevention. And the second category is detection. And the third category is treatment. So those 3 categories will encompass the 7 steps, 7 tools. So the first one, which is prevention, is the most important. Keep up to date with your vaccines, okay? Now, adults now who are 18 and older can get 4 shots. The first 2 are known as the primary vaccines, first and second, which Pfizer has been given, Moderna has been given, or the single vaccine that's been given by Johnson & Johnson. Those are the primary vaccines. Also, the first booster, which is the 3rd shot, or the first, we should say the 3rd vaccine, and that is for adults only. Now, there is a 4th booster, but it is depending whether you should have that 4th booster or not. And that primarily is focused on people who are age 65 and above to get that 4th booster or 4th shot, which is a booster, or if they have a compromised immune system. So if you're in that category, it is recommended that you get that 2nd booster or 4th shot. Now, for children who are ages 5 to 17, they have 3 vaccines. The first 2 are the primary vaccines by Pfizer or Moderna. Then they have 1 booster. Okay, so that's how they get the 3 shots. Now, for children who are ages 5 to 17, there's only 1 pharmacy that has been approved for giving the booster, and that is Pfizer. Moderna has not been approved. They have submitted their work and research. It is still under review. So those of you, make sure that the 3rd shot that you get, which is the booster for your children, is a Pfizer booster. The 3rd category, or the 3rd tool, is, I should say the 2nd, is ventilation. Ventilation. We are strongly encouraging that, you drive, your windows be open while you're driving your car, keeping your windows open in your home. Keep the windows open. School buses, open up the windows as well to keep, fresh air circulating. This will reduce the opportunity of the virus being spread within a small contained area. And the 3rd tool is masking. Wearing a high quality mask, especially indoors, or even wearing a mask when you're outdoors in a crowded area. Okay, so if you live in a community or visiting a community that has a high level of COVID vaccine 19, make sure that you're wearing a mask, and make sure that the mask that you're wearing is of high quality, such as an N95 or a KN94. This will give you further protection from that virus transmitting through your mask. The 2nd category is detection, which contains the 4th and 5th tool. The 4th tool is symptom screening, doing self-monitorization. If you go out and travel outside the state of Rhode Island, you come back home, or you've gone to an event or a public place indoors, or outdoor gatherings such as a sporting event or a performance, a concert, and then you come back home, make sure that you take a self-test at home to make sure that you are remaining negative. Okay, so that is basically self-monitorization, self-screening, and testing yourself. When you start to notice that you're feeling symptoms of not feeling well, immediately call your primary physician or your healthcare provider to make sure that you're not positive. Now, remember, there are two different types of tests that you can take. You can take the antigen test or the PCR test. The antigen test is the home test kit that they provide for you, which you can take, a droplet of, a swab from your nasal, drop it in, and then, you get 1 or 2 lines there to tell you whether you're positive or not. But the accuracy rate out of those home testing kits are only about 60 to 65%, which means that 40% of it has not really been detected if you have it. But a PCR test, on the other hand, has a more reliable accuracy of 95%. So I just want to remind you that if you do a self-testing kit at home and you feel fine, you have no symptoms, but if you really want to make sure, you could still be positive even though you tested negative with those home testing kits because you're asymptomatic. So please periodically do a lot of self-testing. It doesn't cost you any money to do a test. The third category is treatment, which contains tools number 6 and 7. Tool number 6, if you test positive, immediately isolate yourself. And if you're living with people in your household, stay away from them. For the first 5 days, make sure that you're isolated by yourself. Okay, that is critical. The first 5 days is to remain in isolation. Okay. And then afterwards, step number 7 or tool number 7, get treatment. Call your primary physician or your healthcare provider. Let them know that you've tested positive, and then see what kind of medication they want to give you. They may want to give you an oral medication, or they may want to give you the MABS treatment. Okay, to prevent yourself from deteriorating and getting further sick. Research has shown that both of these medications, whether they're oral or the MABS, have good results. So make sure that you get treatment once you test positive. Those are the 7 tools to help protect yourself against COVID-19 going forth. If you have any questions or clarification, feel free to call me at the the Rhode Island Commission for the Deaf and Hard of Hearing. My email address, or my video phone number is 401-216-5414. Or feel free to send me an email. My email is as follows. Thank you, and help keep the state of Rhode Island safe and healthy.